Asthma can become life-threatening, yet most people misunderstand the triggers, the signs and symptoms, and the management. But in this video, I'll be giving you a detailed explanation of what asthma is, the signs and symptoms, the management, and the potential complications that could arise from poorly managed asthma. Now, let's hop in and see what asthma is. Now, before we go further, let's know what asthma is. Asthma is a chronic inflammatory disease of the airway that makes breathing very difficult due to bronchoconstriction, or let's call it constriction of the airways, the bronchioles. They become so tight that it becomes very difficult for the patient to breathe. And that is why you start seeing symptoms like wheezing, cough, and shortness of breath. Now, basically in asthma, three things happen, which are the bronchoconstriction, inflammation, and oversecretion of mucus in the airways. Now, the bronchoconstriction happens in the sense that the airway muscles, or the muscles of the airway, contract and block the airway. It makes, just think of the airway as a pipe that is being squeezed, or a hose that is being squeezed. That is what bronchoconstriction is all about. And now there is also inflammation. The inflammation makes the airway too thick, thereby making the space inside too narrow for the movement of air into and out of the lungs. And there is also oversecretion of mucus. Now, what this mucus does is to reduce the space available for air to pass into the lungs or into the alveoli. So this is what basically happens when a patient is suffering from an asthmatic attack. Now, let's see what a normal airway looks like. In a normal airway, the walls are thin, the muscles are relaxed, and there is normal secretion. That is to say that the secretion is being regulated, and then there is free flow of air into and out of the lungs. But in asthma, the reverse is the case. The wall becomes thick, there is oversecretion, and then there is bronchoconstriction, making the airway too tight for the patient to breathe. Now, let's go into the causes of asthma. There is no known single or proven cause of asthma, although a combination of genetic and environmental factors can lead to this disease that we know as asthma. Now, genetic factors, I mean that the person will have genetic factors that predispose him to asthma, like inheriting a gene from the parents. That is to say that if a person's parent is asthmatic, there is a high tendency of that person suffering from the disease later in life. Now, let's look at environmental factors. Environmental factors like dust, smoke, pollens, mold, stress, even exercise, rigorous exercise can cause asthmatic attack. Also, emotional distress can cause this asthmatic attack. It can trigger inflammation in the airway, and it will be manifested as an asthmatic attack. So these are the environmental triggers that could make someone have this attack. So in trying to prevent this attack, you have to avoid all these triggers so that the patient is going to be fine. Now, there's a myth I want to debunk. So many people believe that one can outgrow asthma, but here is the twist. That is not the truth. When a person is asthmatic in childhood, as the person grows up, the person may have lesser symptoms, because asthma is a chronic disease. People don't recover from asthma. But then, unless there is a divine intervention, people don't recover from asthma. But then the symptoms can reduce while as the person grows up. Comment airway obstruction if you watch this video up to this point. Now, let's go over to the pathophysiology of asthma. This tells us how the disease starts, how the progression, and how it manifests as the signs and symptoms. Let's go further. Now, when a trigger enters into the airway, these are the things that happen. The first thing that happens is that it triggers immune response, and this immune response will trigger the release of inflammatory chemicals like the leukotriene and the histamine. Now, this is what these chemicals do. It causes smooth muscle contractions, We all know that the respiratory muscles are of involuntary control, so they are smooth muscles. So when this histamine and leukotriene are in action in the body, it causes these muscles to constrict or to contract. Thereafter, it thickens the airway. It makes the airway thick and narrow, thereby restricting the flow of air into and out of the lungs. And another thing these inflammatory chemicals do is to cause over secretion of mucus in the airway. And when there is too much secretion of mucus in the airway, there is lesser room for air to go in and out of the lungs. That is why it's manifested as wheezing. You find that this patient will be wheezing, the patient is going to be having severe cough, shortness of breath, and the patient will be breathing with the accessory muscles instead of the normal breathing pattern. If you look at the chest, you find out that the patient is having labored breathing. You will see it evidenced by the chest movement. Now, having known the signs and symptoms of asthma, there are some diagnostic evaluation that you need to do in order to confirm the diagnosis of asthma. Now, let's look at those diagnostic evaluations. We have the first one here, which is the spirometry, and it is the gold standard for diagnosing this disease. Now, how does this spirometry work? It is a test that measures the amount of air that flows into and out of the lungs. So when this test is done, it tells you whether this case is an asthmatic case or not. Now, there's another test that could be done to confirm the diagnosis of asthma, which is the allergy testing. The patient is exposed to different types of allergens, and this test helps to detect the particular thing the patient is allergic to. It could be dust, it could be smoke, or cold air. When this test is done, it could be used to confirm the diagnosis of the disease known as asthma. If your patient is asthmatic, what do you do to manage the patient? We are going to discuss it now. Now, the first drug of choice we are going to discuss is the short-acting beta agonists. Now, this short-acting beta agonist, or let's say beta agonists, work by dilating the airways. Remember in my previous video when I talked about beta blockers, I said that beta blockers is contraindicated in asthmatic patients. This is because it causes bronchoconstriction, which is the problem we have in asthmatic patients. Now, the effect of these beta 2 agonists are the direct opposite of the beta blockers in the sense that they dilate the airways. So, if you want to know more about beta blockers, you can go back and watch that video. But for this video, we are talking about beta 2 agonists. This, and we've said that these beta 2 agonists dilate the airway, they cause bronchodilation. And drugs under this class are the salbutamol and the terbutaline. So if you want me to talk about these drugs, let me know in the comment section. Now, another type of medication that could be used in the management of asthma is the systemic corticosteroids. And what these medications do is to inhibit the inflammatory reaction that is going on. But then you have to take caution when administering these corticosteroids because improper administration of these drugs could lead to severe complications. Now, what type of steroids are used? We have the prednisolone and the hydrocortisone. These drugs could be used to manage asthmatic attacks. We also have the long-acting beta agonists. These ones have a long half-life, but then the onset of action is very slow, unlike the short-acting beta agonists that have a short life, but then the onset of action is very fast, like they act fast. But then these long-acting beta blockers are slower, but the effect lasts longer than the short-acting beta agonists. Now, drugs that fall under this category are the salmeterol and the formoterol. There are also other drugs that you may want to talk about under this category, but for the sake of this video, we're going to be talking about just the salmeterol and the formoterol. Now, asthma can also be managed using inhaled corticosteroids like the fluticasone and the beclomethasone. These drugs exist as inhalers, so for the prophylaxis of or the prevention of asthmatic episodes, A patient can take these inhalers maybe before a stressful activity so that he or she is not going to have episodes of asthmatic attack. Now, let's talk about the non-pharmacological management of this asthma. And these are the steps the patient can take, or even you as a nurse, to advise the patient to undergo these steps so that it's going to prevent asthma or manage the symptoms before medical care arrives. Now, to prevent asthmatic attack, the person is advised to avoid the triggers. Triggers, I mean the dust, mold, cold air, emotional stress, and every other thing that is linked to asthmatic attack. It is also advisable to do warm up exercises before you start the main exercise, because jumping into the exercise abruptly can irritate the patient and boom, the asthmatic episode starts. If you want me to debunk more myths about asthma, let me know in the comment section. But for now, let's call it a day. And if there is any other topic you want me to talk about, let me know in the comment section. Bravo.